Good afternoon, everyone. My name is Prashant Kumar. Welcome to the Reclaim Network Plus webinar series. So this is one of the 18, the kind of webinars, and this is number 2 in the series. So before I start, just to briefly, give some housekeeping notes. So this webinar is being recorded so that we can make it available to you to watch later on. If you have any questions and answers, you can use the Q&A box on your screen, and you can type your questions. And if you want your name and affiliation to be mentioned with your question, so please write them with your question as well. We will have the 2 speakers today, and they will take the questions and answers after they have finished speaking. So just to say, the very briefly that this is our team from the Reclaim Network. So I've got 2 of my colleagues today online as well. So Professor Lauren Jones and Dr. Nerea Calvillo. We have other colleagues from Bangor and Bath. And this is a network basically, which we currently have around 303 members. And if you haven't really been a member yet, so you could still have an opportunity to join, and you can see the link in the chat box. So today's session, Dr. Nerea Calvillo will be doing the chairing the Q&A, the session later on. So as I said earlier, this is the 18th webinar series that's going to end in March 2024. Usually this is the first Wednesday between 12:30 and 13:30, basically our the UK time, just to cover the lunchtime. And we usually have 2 speakers, and trying to have the mix of the colleagues coming from academic and the non-academic sectors. You can see the webinar 1 was delivered by the colleagues from RHS, the Wisley, and the company called Product Owner. You can, if you missed that webinar, you can watch that webinar on our the YouTube channel of the Reclaim Network. So you can see the link again in the chat box. So the whole idea of these webinars is to share the best practices and facilitate knowledge exchange between practitioners, researchers, and policymakers. So this will, the continue. Be delivered through the invited speakers as well as the cross-sectoral network members. So in this, in this direction, we have been inviting, the colleagues who could possibly contribute to the webinar series, but we also got an open call for the speakers. So you can see another link in your chat box where you can simply fill a simple form if you are interested in being one of the speakers for these webinars, or just drop an email on info@reclaim.network-network.org, and we can be in touch with you. But before we introduce our today's speaker, I would also like to pinpoint actually this opportunity for the funding for the secondments. So this could be for any early career participants, either you are a PhD or a postdoctoral researcher or an engineer, or working for a charity, government organization, or any environmental groups. So it's an opportunity for you to work with the people working in the domain of the sustainability of cities using green, blue, and grey infrastructure. So again, you can have the call form directly from there, and you can always we will encourage you to apply and possibly disseminate among your group as you see relevant. Now, I would like to take an opportunity to invite our first speaker today. He's Marc Barra. Marc Barra is an urban ecologist from the Paris Region Institute. He leads projects in relation with nature-based solutions applied to urban planning and architecture. He's currently involved in Horizon 2020 project called Regreen, and in the French capital of Biodiversity Award. So you will see that a very interesting presentation coming from Marc. So over to you, Marc.
Okay. Yes. Good afternoon, everyone. Thanks a lot, Prashant, and all the team of Reclaim for inviting me to this webinar. I'm very happy to be here. I just put my presentation in full screen. Well, yeah, so my name is Marc Barra. I'm an urban ecologist from the city based in Paris, and I work for the Paris Region Institute, which is a planning and environmental public organization of the province of Paris that we call the Paris region. We're part of this Regreen project on nature-based solution. And recently, we've been working on a tool to help cities to address the de-paving issue. And that's why the title is De-paving in Paris region, literally making more space for nature. So I'm really happy to share with you some of the work we did and share also some examples of de-paving and renaturing cities in the Paris region and also elsewhere. So just a couple of words of the Paris region, what we call the Paris region or province. It's the smallest province of France, actually. It's only 2% of the French territory, but it hosts 20% of the French population. So a huge density of population concentrated in the city of Paris itself, that you can see here, and in the metropolitan area of Paris. The city of Paris is one of the densest city in Europe. So a lot of challenges, and 23% of the Paris province is occupied by urban areas, and around 16% of this is sealed. So a lot of challenges actually, and if we ask the question, why de-paving and making more space for nature? Well, actually to cope with what all other metropolises have to cope with today, climate change. We experiment in the Paris region more frequent climate change events, recent flood events in 2016 and in 2018, recent urban heat island effects in 2003 and in 2022 this year, last June. But also we have to face a strong green space deprivation for the people. Actually, in the province, there are more than 1,000 cities, and 935 of them are considered as green space deprived, so less than 10 square meters per inhabitant, and 57 as very deprived, below 5 square meters per inhabitant. And then also biodiversity, of course. I work for the biodiversity department, so we monitor biodiversity, and there's a strong biodiversity loss in urban, both and rural areas, with some figures here, for example, on bats. 50% of bats in abundance have disappeared in the last 10 years. The same for butterflies. Abundance have decreased by 30% in the recent 10 years. So we have to face all these challenges. The problem is that there is a strong competition for the land, for space, and I guess it's the same in other metropolises. There's this paradox between the need for reducing urban sprawl, reduce urbanization, then the need for more densification if we want to reduce urban sprawl, and also the need for more green space. So that's quite a tricky equation. We have to solve that. And that's why we decided to target actually paved and built up area in cities, because there's no more space remaining for nature. And we consider that there is an unestimated potential of paved areas that could be turned into green areas. So the reason why we target those places was also to achieve the zero net land take objective in France. It's also an objective from the EU. The French government has decided recently to set up this objective, and the land take must be in France in every province reduced by 50% by 2030. And then the zero net land take objective will have to be achieved. That means restoring the equivalent of surface consumed by urbanization by renaturation strategies. So that's a huge deal at the moment in France, and we have to find place to renature. The second reason is that transforming mineral areas will provide the maximum benefits for the people, for climate adaptation, and for biodiversity, because we start from nothing, minerals places to green areas. And then the third reason is because we consider as ecologists that recovering soils is essential to develop nature-based solution. Often when we mention nature-based solution, we think about green roof or green walls, which are really interesting, by the way, but it is above ground vegetation, if I could say this way. But in ecology, the most important is the soil. So there's we have to do a step forward to make new functional soil and to help cities reclaiming their urban soils, even if they are polluted a lot, even if those operations can be also very expensive. So what we did is that we worked on a GIS tool actually to help cities address this de-paving challenge. And instead of choosing randomly, searching randomly for paved areas, which is the case nowadays. Actually, some cities are interested in de-paving and they choose schoolyards, for example, or some parking lots, but it's quite a random strategy without a scientific approach. So we decided to develop this tool based on a scientific approach, and we started by looking at three main challenges, that we consider as the main challenges today in our society: biodiversity, then climate change, then health and well-being of the people. We started to gather the data of those challenges, and the second step was to define indicators to approach those challenges. So we selected 3 indicators for each of the challenges. For example, for biodiversity, we use data on the size of green space in the urban area, the vegetation cover, and also rare habitats for biodiversity. So we could have chosen more indicators, of course, to define those challenges, but we select them because the data was available at the scale of the Paris region, and we could do this GIS tool properly. Once we have the indicator, we have defined some thresholds. For example, for the vegetation cover, we consider that below 45% of vegetation in each mesh. By the way, one mesh is 125 square meters. It's not sufficient for biodiversity, and above it's sufficient. So using those thresholds, we define some scores, which is the third steps, that allow us to map actually the challenges. And that's the fourth step. Here you have an example of a map regarding the challenges on biodiversity, climate change, and health and well-being. So the red and yellow square are the places on the map that are the most affected by those challenges, where there is a vulnerability regarding climate change, vulnerability regarding biodiversity, and vulnerability regarding health. So that's the first part of our tool, defining some areas where there are big challenges. And then the last step, which was also important and was the main goal, is to search for paved areas on those meshes that are affected by these challenges. So we have the chance in the Paris region to have a soil occupation system, which is called the MOS, mode d'occupation du sol. And we use this database to select a typology of paved areas such as parking lots, schoolyards, residential yards, public spaces, but also some residual areas on sidewalks and on roads, on different roads. So we have a typology, and then we search for this kind of paved areas. We've been looking at what the tool says at the scale of the metropolitan area, and here I can show you some results regarding the biodiversity criteria here. So if we, on the left side, you have one map for each indicator, for example, the vegetation cover. You can see that in the city of Paris, in the very center of the map is affected by vegetation cover deprivation. We also looked at rare habitats for biodiversity, which are really scarce all over the metropolitan area of Paris. And then the size of green space. There are just a few remaining big green space in the metropolitan area of Paris. So most of the metropolitan area is concerned by this challenge. And then when we overlap all these indicators, we have a global map of what we could call the biodiversity vulnerability. And all the meshes that are in red means that there is a critical action to do for biodiversity. And then we repeated the same process for the two other challenges. For climate change, as you can see here, the indicators are the exposure to flood risk, and you see that this risk is concentrated along the main river, the Seine River, but also another one, which is La Marne here, river. We looked at the exposure to runoff, which is quite widespread all over the metropolitan area of Paris, and then the exposure to the urban island effect here, which is mostly concentrated in the city of Paris itself and in the very dense city center of Paris. And here again, we overlap the maps and we have a global map of climate change vulnerability. And then same logic for health and well-being issue with the three indicators: green space deprivation here, the air pollution, which is also which concerns all the metropolitan area of Paris, and which is related to the traffic, of course. So nearby the big axis and big roads, the square are red here. And then the vulnerability to urban heat island. So it's not the urban heat island itself, it's in relation with the people and the capacity to cope with that heat waves. And then again, a global map of this health and well-being risk. So the tool allows us to have different maps for biodiversity, for climate change, and for well-being that we could use separately or that we could overlap just to help the cities to define the main challenges they have to cope with. So that was the result at the scale of the metropolitan area of Paris, but you can imagine that it's quite a wide scale and maybe too large scale. So we were also able to look closer at the scale of any municipality in the perimeter of the metropolitan area of Paris. And here, that's the same tool applied to the city of Aulnay-sous-Bois, which is a city in the northern part of Paris, quite a big one with 83,000 inhabitants, with different types of urban morphology. And here again, you can see the different maps, and most of the challenges are actually concentrated in the northern part of the city, which is made mostly of commercial buildings, of big parking lots than like the one I had in my first slide here. So there's a huge potential in this part of the city to de-pave and to reduce the risk of climate change and biodiversity. And here again, if we look closer at the paved areas in the city of Aulnay-sous-Bois. Here you have a capture of all the different sites that have been selected. And what could be interesting with our tool is that we can calculate those different surfaces of paid area in the city, and then give some quantitative elements for the city to address, for example, the zero net land take challenge. So the results here for Aulnay-sous-Bois, we found a total surface of paid area of 265 hectares, which is roughly 15% of the city's surface. So that's the overall amount. But if we look by different types of challenges, for example, for biodiversity, 228 hectares are concerned, 158 for climate change, and then almost 100 for health and well-being. So we could also address this de-paving challenge regarding the different issues. We can also look at the total surface regarding the number of challenge. And here in Aulnay-sous-Bois, if the city wants to address just one challenge, for example, biodiversity, it's 71 hectares that are concerned. 2 challenges, 84 hectares, and 3 challenges, 83 hectares, and so on. We can do some different calculation, but the 3 challenges together are interesting. It means that if the city really want to tackle the climate change, the biodiversity, and the health issues, well, restoring and renaturing 83 hectares could be sufficient and could be a good objective and target. Okay, well, that was the tool that we provide. Of course, there are a lot of limits, and it remains a tool, I would say, on the computer. So now we have some next steps to help the cities. The first one is assessing the feasibility, doing some field trips with the municipality to validate the tool. So we have to go on the field and see if the tool works. We could involve the inhabitants also to identify more sites to be de-paved and renature. Then we want to select some experiments, renaturation techniques, because it's quite easy to find some sites, but it's not easy to restore. Restoring the soil functionality needs some ecological engineering techniques to choose the plant communities, to create some specific habitats for species. So we are currently selecting some experiment sites, and then do the monitoring and try to evaluate the success of operation. And then we also provide the city with tools to protect those renatured area. Just a few examples quickly, because we're actually publishing a document on renaturation, and we found some interesting case studies of renaturing in urban habitats. So here, for biodiversity, that's the Kodak factory in the northern part of Paris, in the city of Sevran, where you see that all the buildings, the former buildings in a brownfield, have been demolished, and the park was turned into a high ecological value green space, with grasslands, with shrublands, and with also some trees and wooden areas here. And what it's interesting with biodiversity is that it is kept as a brownfield, like with free evolution of vegetation. There is a very, very low management. So that's also interesting, where you turn a place into buildings to a free evolving, I would say, ecosystem in cities. The second one, maybe you've heard about this one. It's in London, actually, and I love this project because usually when we talked about renaturing cities, biodiversity is not always addressed, actually. And here in this project, it's called the Beetle Bump in London. This one was specifically designed to maintain and to create the habitats of a small insects, which is called the strict bombardier beetle. Actually, that's what we can call biodiversity-led renaturation. And here, so they create this habitat by using specific soil, specific blend of low nutrients and aggregates. They sow white flower, typical of the region, and then they managed to create the habitats. And the survey that they did afterwards showed that there was a community of this beetle, but also other species that like this kind of habitat. So nature-based solution and green infrastructure should also consider the different kind of species targeted on the project. An example in Geneva, in Switzerland, renaturing means also renaturing the quality of the soil. And here, which is called Nos Trees project, the city actually encourage digging new continuous trenches for the trees. So what they did is that they replaced individual trenches for the trees that are usually too small for the trees to grow and thrive, and replace them by continuous trenches with continuous soil in it. And that's also a very good example of changing the environment of the traditional concrete sidewalk with a continuous urban soil. That's well in the same logic than ecological grids and corridors applied to the soil. Two examples regarding climate change adaptation and renaturation. Here, it's a reopening of a former stream in the city of Sarcelles in the north of Paris. The stream was actually buried and in pipes below the road that you can see on the left part, on the left photo here. They removed completely the concrete, they removed the pipes, and they applied ecological engineering techniques to restore the stream, as you can see on the right here. So that's also a very big potential regarding rivers and reopening rivers in cities. And here they were able to address both climate change issues, because the center of this city used to be flooded several years ago. And that's also a new place for biodiversity and specific species of wetlands. And then another project in Aubervilliers, also in the north of Paris, which is called the Tierce Forêt, the Tierce Forest, I would say. And it's quite amazing. We're in between objective of climate change adaptation, but also improving the living environment of people. And here you see on the left, that was a former car park of residential areas in Aubervilliers, and they turned it it's a group of architects, fieldwork architecture, and also the city. They turned it into what we could call the tiny forest, or a wooden area in this place to reduce the urban heat island. And this project is quite nice. So it's not a complete renaturation, because they choose to replace the pavement by pervious concrete because the people decided it. But it's interesting, as they choose the species of trees, and they choose where to place the trees regarding a diagnosis of the urban heat island in the place. So they did a lot of monitoring to be able to place the trees at the good place. So also the need, when we address renaturation and de-paving, the need for indicators and evaluation before and after the project. Okay, and I finish here with this also another project, but very nice, made by and for the people in the same city of Aubervilliers. I like this one because it's an artistic project, but also very low tech. It didn't cost a lot, actually, and there's no need to spend so much money for renaturing city. Here they just crack the concrete, actually, and they leave it on the site, and they let the spontaneous vegetation grow with some plantation as well. And you can see on the right, it turned into a rocky garden, quite spontaneous, with brownfield, and it replaced a former parking lot that was unused by the resident here. So renaturing cities is not always expensive, and it can be turned in new artistic projects. I think my time is over, so I stop here. Prashant, thank you very much for listening. And of course, if you have questions, I will answer them. Thanks.
Thank you, Marc. This is fascinating. And these examples are really, eye-opening in a way that these things are happening, but sometimes we don't really pay too much attention to them. And as you rightly said, it's not always expensive. It's more of like, how do you think, and possibly you can turn something looking very gray into very green and very artistic. So thank you very much, Marc. So we have some questions, but my colleague will take those in the question answer session later on. So we can possibly move on to our second speaker today. So we have Professor Eiman Kanjo, and her smart sensing team at Nottingham Trent University has successfully developed and set up a social prescribing platform called tagwithme.com at both Rufford County Park and Highbury Hospital in collaboration with Nottingham County Council and Nottinghamshire Healthcare respectively. So Tag With Me is a gamification platform that aims at improving well-being by visiting local parks and being physically active. So the platform utilizes wireless tagging features that send challenges, AI quizzes, and prompts directly to the user's mobile device. Eiman also works closely with the Nottingham County Council on developing its Smart Nottingham initiative, including the current development of mobile environmental monitoring stations in Nottingham City Centre. So welcome, Eiman, and we are looking forward to your presentation. Thank you.
Thank you very much, Prashant. I think my talk links very well to Marc's talk. He is renaturing everywhere, and then creating all these green spaces. Then maybe we can use our technology to encourage people to use these green spaces. So hello everyone. We are here today to talk about Tag With Me, which is a technology-based green social prescribing platform that merges storyfying and gamification features to attract people to connect with the green spaces and be physically active. So the agenda for my talk is as follows. I will talk briefly about social prescribing, green social prescribing, and the use of technology for social prescribing. And then I will talk in more details about the Tag With Me platform, the umbrella for two mobile experiences. The first one is Tag in the Park game, which is currently set up at Rufford County Park. And the second one is Tag for Active Lives at Highbury Mental Health Hospital. So I'm sure many of you have heard before the term social prescribing, or at least use some kind of non-medical services or non-clinical services prescribed by local support groups or by friends or families, like for example, taking an exercise, taking art class, dancing classes, or even playing around the parks or planting some green plants and so on. So the concept is around, but now it's being more formalized. And recognizing that people's health is determined primarily by a range of social and economic environmental factors, social prescribing seeks to address people's needs in a holistic way. And it also aims to support individuals to take a greater control of their own health. For example, here in the East Midlands, we have a wide range of social prescribing programs, including paddle boarding, well-being walk, crafting, traveling on narrowboat, and many other activities. The evidence suggests that social prescribing can reduce the burden on primary and secondary care. So there's some evidence, but it's not enough. And the reason for that, it's very, very hard to measure. Like, for example, if I go for a walk, it's very difficult to measure the impact on my well-being, even though I know it might have helped. So we need new approaches to measure the evidence. And social prescribing works for a wide range of people, including those with one or more long-term conditions, acute conditions, who need support with their mental health, who are lonely or isolated, or with complex social needs. So basically, it works for anyone with any health condition. And NHS has been thinking about, implementing social prescribing in its system, and there's currently NHS long-term plan to put it in place. So at least 900,000 people are expected to be referred to social prescribing by 2023 and 24. And that's part of the drive to universal personalized care that will see at least 2.5 million people benefiting from this kind of personalized care. So it's on the NHS agenda. Then I move to green social prescribing, because I mentioned that there are different types of social prescribing, besides walks and exercise activities and so on. And green social prescribing is basically professional healthcare provider might ask a patient to go and have a walk in a green space, such as a park or a forest. And this might include some kind of activities such as walking, cycling, community gardening, planting trees, and so on. And normally I use the term green places as remedies. This is my own term that I invented. And the idea is that you could use green spaces or places the same way you use like herbal tea. Like you feel like you're not very well, you go and make some kind of chamomile tea. And the same way you could use green spaces to improve your well-being. In Nottingham, we are lucky to have green social prescribing program, which is one of 7 government programs or sites. And this is carried out by Nottinghamshire Integrated Care System to run 2-year pilot project. And the idea is that clinicians or primary care professionals can refer people to local non-clinical nature-based activities. So we are working with them on all sorts of things to see how can we benefit from this program. And then social prescribing can benefit from technology because technology is advancing all the time. It can make life easier and can make the social prescribing easier and accessible to everyone. So many of you have used wearables, mobile phones, tags, sensors, and so on, which can be utilized, as I said, for social prescribing. However, digital social prescribing doesn't need to replace face-to-face services. It can complement it. And as I said, it can make it faster and accessible. And here is a list of benefits of social prescribing or digital-based social prescribing. As I said, it's cheaper. It will enable faster feedback if needed, access to social prescription services, and it's easy to check progress of clients. And it's personalized as well. Now I move on. So we know what social prescribing is, what green social prescribing is. Then I move on to Tag With Me, which is, as I said before, it's a technology-based green social prescribing that takes advantage of technology, in particular, artificial intelligence, Internet of Things, wireless tags and sensors, and so on. So Tag With Me is a platform, the umbrella for different types of mobile experiences and games that we develop on top of it. And it has at its core a mobile app that runs the treasure hunts kind of challenge, supported by proximity detection technology, which is similar to location-based technology, but it works on proximity and how close is the person to a specific place. And this kind of game can be played anywhere around specific green space. If the platform is set up anywhere in terms of the location of that park, and at any time. So there's no specific route for that. As I said, Tag-on-Me is the platform. And then we created two kinds of mobile experiences. The first one is Tag in the Park, which is funded by DCMS in collaboration with Nottinghamshire County Council and Parkwood Leisure and many other project partners. And it's currently set up at Trafford Country Park, and we have an app that is available on Google Play and Apple Store. We have also a number of devices scattered around Trafford Park, which is very close to the famous Sherwood Forest, north of Nottingham. So as I said, we have 16 different points of interest that the users or the players have to visit in order to complete the whole challenge, and then they get a reward if they complete most of it or all of it. And we try to make it as enjoyable as possible. As I mentioned before, we use proximity detection mainly because it makes it easier not to rely on GPS, and also it gives the indication that someone is close to a particular point of interest, and it can be extended to indoor places, for example. So we don't need to rely on GPS. And you can see here, you can see here one of the tags. So we have 16 of those embedded around the park. So I'll show, yeah. So this is the map of Trafford Country Park, which hosts the famous Trafford Abbey in here. And you could see that we have embedded a number of devices, as I said, around the park. So players can play anywhere really. And you could see here some of the traces of movements of our users over a long period of time. So how to play the game? First of all, you need to be physically present in the park, so you can't play it remotely. When you go to the park, you download the game by tapping the tag, the wireless tag, or using the QR code. Once you have got the app, you'll be presented with tutorial and guides and so on, and then you will start playing this kind of treasure hunt game. You'll be presented by a number of points of interest, like 16, as I mentioned before, and then you have to visit most of these places and then in order to get the reward. But as I said, it doesn't need to happen in one go. Like, for example, someone might start the game, have lunch, come back again with family, and so on. And the app gives you some indications what you should do, like you are getting close to the next point of interest, or you need to keep walking, or you're getting close, and so on. So it gives you some hints. And what we've done, we created 3 types of challenges. I mentioned before that we use AI, tagging technology, and so on as part of the game. So the 3 challenges are attached to some of the points of interest. So some points of interest will ask the users to answer a question, like when they get close to one of these smart tags. And then they have to answer the question. And this can educate people about, the nearby area and the history of it. And then if they answer the question, they get a point. And then they are asked to move and carry on until they find the next point of interest. Also, we utilize AI, artificial intelligence, and the camera for object recognition. So the idea here is that we have many sculptures and features around an open park, for example. And we felt it's a good idea to link people to these, areas and to these features, and they understand more about the history of that place. So in some points of interest, they are asked to point the camera at this particular sculpture or the other one, and then a model will assess the accuracy of that sculpture, and then if it turns out to be the right one, they will get another point, and then they will be asked to move on, and so on. So most of the sculptures are trained, like in terms of their images, on our model, on our algorithm. And the third challenge is that some points of interest will ask the users to tap a tag, which is around a point of interest. So scattered a number of wireless tags around, which looks like a contactless card. And then the users have to tap it and then they get the point. And also we capture the step counts. So to keep people informed how much they walked, and also can be useful for future challenges for people who want to run or compete against each others. We run some studies, questionnaires to get some feedback from our users, and we receive very, very positive responses, as you can see here. We asked them how many points of interest they managed to visit and so on. So the feedback so far is very positive, and they want to see more of it in other places. So that's Tag in the Park, the first mobile experience. The second one is Tag for Active Lives, which is currently set up at Highbury Mental Health Hospital in collaboration with Nottinghamshire Healthcare NHS Foundation Trust. Because when we developed Tag in the Park, we talked to our collaborators from the live team at Nottinghamshire Healthcare, and they were very interested to see if they can utilize the technology to improve their inpatient experiences. In particular, they have this, what is called the mile walk around Highbury Mental Health Hospital, which is currently boring. There's not much happening around it, but the patients are asked to walk every now and then around it. So the discussion was, how can we make it more interesting and enable patients to engage with the greenery space around the hospital. So it's currently set up at Highbury Mental Hospital, and we are in the process of launching the platform formally. When we started collaborating with Nottinghamshire Healthcare, we talk to the clinicians, the mental health experts, in order to see how can we co-design the whole experience with the patients. And since we don't have sculptures around the hospital the same way as Rufford Country Park, we asked if the patients themselves can create their own paper maches, as you can see here. And then we could hide them around the hospital ground and around their garden in order to replace the sculptures, which worked very well. And you could see some of these are really, really interesting paper maches, and they are waterproof. And the same way as the other game, we utilize AI, the camera, the tags, and so on. You could see some of these paper maches hidden around Highbury Hospital. Just to show you a map of the hospital here, similar way to Rufford. This is the mile, the Highbury mile, where the patients normally walk with staff and so on. So we placed our tags around the hospital, and with all sorts of challenges, like for example, the tag challenge and the AI, the questions and answers and so on. And the patients normally get rewards if they complete the challenge and complete the walk. So Tag with Me and the two mobile experiences, Tag in the Park and Tag for Active Lives, offer many features, many possibilities. As you can see, for example, we offer rewards, promote physical activities. Everything happens in real time. It links people with nature. We don't replace that kind of connection, just that the technology enables that kind of engagement, encourages people to walk more and so on. And also it contributes to the visitor economy in general. In terms of next steps, we have a lot on our mind. We want to improve the content, so we want these kind of contents given to us by the clinicians, you know, more like personalized. We want to add themes, like for example, during Christmas or during Easter and so on. We want to study the impact on mood and try to collect the evidence And we want to roll it out to other sites, whether it's other mental health hospitals, other parks, or even other places like schools and local gardens and so on. We about to launch the platform officially on the 20th of July at Highbury Mental Health Hospital, where we invited many collaborators from the City Council, County Council, MPs, other voluntary groups like Active Nottingham and so on, to see how can we work together to roll out this platform to other places. Yeah, so we have a lot of work on our hand, and hopefully we will be able to share the results of how did this go in the very near future. And I'll stop there.
Thank you, Eiman. This is very interesting. It allows basically, the concept of the green kind of prescribing even more, the exciting and enjoyable for people to, play and learn actually about things. So this is very, excellent work you have been doing there. I think I'm going to pass on to my colleague now to chair the Q&A session, since we only got 8 minutes. So yeah, over to you, Nerea.
Thank you, Eiman and Marc, for these wonderful presentations. There's already some questions for you. Please, the rest of the audience, you can write your questions in the Q&A that you can find at the bottom of your Zoom screen. So first, we have one question for Marc. He says, thank you, Marc, very good research. And Abhishek Tiwari asks, what substrate material and green paste cover would you consider appropriate, mainly considering their seasonal performance issues, to offer a stable pavement structure with least management demand for local authorities?
Oh, okay, thank you. Well, good question, but well, I would say that I want to remove the pavement actually. so I don't know if I'm an expert on pavement. We try to remove the concrete and the pavement, but of course sometimes we need some pervious pavement for water management and, for example, on a roads and sidewalk. I'm not a specialist. What I see on the field and in cities we're working with is that those evergreen systems are not working well because it breaks easily. This is plastic devices with a lawn grown inside. It doesn't work properly, and it's plastic. So I fight to remove every kind of plastic in landscape design, and I have like a zero plastic policy for every landscape design. So I would avoid evergreen systems, but the pavement with combined with vegetation works well. Then we have to choose the vegetation. So I don't know the exact name in English, but there's a lot of plants that are either local and also tolerant to be walked on, like the bluegrass, for example, or nettle species, some of them. So we can find easily some list of species to cover those pavements. And the last thing is that there are more and more pervious pavement, pervious concrete, but it doesn't work properly for water management because it gets stuck and clogged with sand and dirt usually. So I don't know if there are new systems, but we need to ask hydrologists and specialists for that.
Thank you, Marc. This is a question for Eiman. What is the source of landmarks, such as parks and other places in the app? Are they loaded beforehand or picks up from the Google map?
So,
and what would be the, oh, please.
Go ahead.
No, please.
So for example, for Rufford Country Park, they already had an app, but it was more static. So they had some features, they had points of interest for people who want to visit. So we took that and added to it. And we were working with them. So we've been there like almost like every day, trying to take some photos and visit every single place and try to figure out which one we should select and which one we shouldn't use.
Thank you. Another question for Marc from Paul de Silva. Are you looking at ways to remove or de-pave people's front gardens that have been covered with hard surfacing. This is a growing problem in UK cities.
Good question. That's also a problem in France residential areas. And well, actually, the methodology I talked about is only focuses on public spaces. So we were only able to gather data from public spaces and not private ones. So I don't have the information, but what could be interesting is that if we enter a second phase where we go on the field with cities just to test the methodology and check for places, we could involve inhabitants and do this kind of projects. I was actually thinking about a citizen science project where we bring the people on the streets or in their gardens, and then we checked for this kind of paved areas that could be removed. That's a good idea.
Thank you. Another question for Eiman. How do you perceive the engagement from different types of users, future users of your app? Because sometimes, well, there's a digital divide on the one hand, and there's people with less gamification experience. So how are you dealing with those differences?
Yeah, so we've been very lucky because we've been working with the hospital, right? And they have plenty of staff to help with that. And we asked staff to take part in that first to get used to the game. And with the patients, they have been working with us, with the team, in order to understand how the technology works. And we gave them some, mobile phones. If the hospital, for example, doesn't have the right devices, we could help with that. We didn't find any problem in terms of the users using our technology because we tried to simplify it as much as possible.
Thank you. There's a couple more questions, but I'm afraid time is over and we need to wrap up very soon. So I'll hand over to Prashant for the last remarks. Thank you both.
Thank you very much, Nerea, and sorry for not having enough time to go through these questions, but we will try to see. But you can see those questions. I think we can share possibly with the speakers, and they could, somehow we can make it available to our audience. Yeah, so I think before we wrap up, and thanks our speakers and the Q&A chair, I just wanted to bring your attention to the upcoming webinar that is going to be on 3rd of August, the same time, the UK time. And we have two speakers. So one is Professor Rakesh Misra. So he comes from University of Huddersfield, and he's going to talk about the modeling for the digital twin in an indoor environment. And we have an exciting speaker actually from the US EPA, the United States Environmental Protection Agency, talking about the green infrastructure for air pollution mitigation. If you have been working in this area, you may have heard the name of Richard. And I think this is highly recommended to attend these the presentations in the upcoming webinar. So you can see the registration link on the chat box. So you can you can register there. I guess the last thing is basically to thank both our speakers for the fascinating presentations. So they were really complimentary, but bring the real world issues and tackling the issues of how the green infrastructure can be implemented and the benefits of them can be accessed through the different techniques. I think we will continue to bring these kind of the seminars in the upcoming webinar series. And just before I finish, I would like to remind you to the call for webinars. So if any of you is interested to be any speaker, so either please drop an email or just fill the form, which you can see in the chat box. And we have this exciting secondment opportunity where you can work with the colleagues across the UK, and you can apply for the funding. It's a simple state form actually. So you might want to look at it and possibly promote within your network. So last but not the least, thanks to our, can you go to the next slide, please? To our Q&A chair, Dr. Nerea Calvillo, for your excellent work for chairing this session. And if you have any queries, you can always drop on info@reclaim.network.org, but you also know the team of the network, so you can write to any of us and we will be in touch with you. So with that, I would like to thank everyone for your presence today, and we look forward to see you in the next webinar. Thank you very much.